should lead that fire alone.
Welcome back to the Now Morning Show. It's 22 minutes past the hour of 6 o'clock, and it's time for Spotlight, where we take a look at innovation.
And we are looking forward to this conversation where we discuss the importance of regulating electronic cigarettes and harm reduction. Looking at We Are Innovation. To do that, we have Tetiana Rak and Miguel Okumura. Thank you very much for your presence. And I think I want to start, who shall I start with? Let me start with you, please, Tetiana. What is the main point of what it is you're doing in terms of this work and the innovation?
So We Are Innovation is overall the network. We are operating globally, and we currently have more than 50 partners all around the globe. These all are advocates, organizations who are believing in the power of human progress and innovations. So as the organization, we overall have lots of projects, all are connected to promoting global and human progress. So this is one of the fields that we are working on, which means that we believe that innovations can contribute to the discussion when it comes to public health. And right now we are here at Trinidad and Tobago to continue this conversation, to meet the government officials and to showcase the efficient examples of other countries that use innovations and help people to quit smoking and achieve better public health goals.
And just before we shift to Miguel, speak to the person who they think they have an idea. They're not sure how to carry that idea forward. It's a different idea. It can turn the way we think on its head, but sometimes I think it might be a little too small to actually bother with.
Well, I think that there are no big or small ideas. All of them are important equally, right? And I think that sometimes people are just not aware how much of the change it can bring, and that's why we're here to enhance this dialogue, to explain what exactly was done before when it comes to this kind of work, what successes can the country reach, speaking of Trinidad and Tobago, and what are the leaders, which countries are already the leaders in the niche, and how their experience can be introduced to the local context, how it can be put, and basically how the global cooperation can enhance these efforts.
And I'll take that from this conversation in terms of there are no big or small ideas, but it's just how it is we implement and how it is we use them. Let me bring you in, please, Miguel. Some people would have said that, okay, well, we're moving from quote-unquote normal cigarettes to different types, electronic cigarettes. Are there dangers, are there harms with potential with those?
Actually, yes. You can have everything in life. You have a good part and a bad part. You know, it's a balance, right? So I am an ex-smoker who stopped smoking entirely using vape, and I know that it can be strange. I know that can be strange. I know that looks the same, the gestual, the nicotine, right? But if we compare with another country like Britain, they have a program called Swap to Stop. So if I live, I'm from Brazil. If I were from Britain, I will be a public health success story, because it could be my history. It can be the same of another person of England who stopped smoking with the program Swap to Stop. But in Brazil, just because our regulation is a little different, my activism is almost like a sanitary crime. So when Tetiana was telling you about, it's not about small or big things, it's what you can do to make your country a better place. And I do really believe that we have to have alternative to the people who smoke, because I know how it is to smoke without wanting to smoke. It makes sense to you, like something,
it does.
Because the majority of people who smoke smoke because they are addicted to nicotine. And what we can do about it? Because there are people who can manage to stop alone, but there are a lot of other people, and I was one of them, who couldn't manage to stop alone. So we need we need help. And these new products can be a help if they are regulated adequately, you know?
And I like the fact that you talk about one, positionality. So if you were in Britain, you'd be a success story. If you're based in Brazil, so it's less so. And then you have me thinking back to my own experience with nicotine, with smoking. My situation was a little different. I wasn't totally just, I'll say addicted, but I had a broken leg, and the doctor said that nicotine would stop the leg from, or it slow down the healing. So I was like, okay, say less, doctor. But at the same time, I may have jumped into other things. But what are some of those things, when you talk about help, what are some of those things that the research has shown, okay, these are things that help move that away, that help to change some of these habits or to address some of these addictions?
Yeah, because to me, originally I am an electrical engineer, so this part of public health and promoting THR, it comes from my history actually. And can you repeat the last part of your question?
What are some of the things that help make the switch?
Yes, I didn't believe that this solution could work when I met this for the first time, and I thought it looks the same. It's like it is a duck, like it swims like a duck, it speaks like a duck, so it's a duck, right? And I was trying to stop smoking, and I asked myself why I would start to use this if I'm trying to stop using nicotine. So that was a point that I had to understood to move forward. My addiction was in nicotine, not in cigarettes. And the cigarettes, it's a very, very popular option, and by design, it kills 50% of these users. So we have to do something, right? And when we are talking about harm reduction, we are talking about 95% of harm reduction. So it's harm reduction to a point that you can begin to imagine a world without cancer, without pulmonary diseases, or with less. And then when you look to the public health, you can use that money to fund another things. Because if you work with harm reduction, not just in tobacco harm reduction in general, it's a way to look to the problem in a preventive way, to try to stop the harm you are trying to avoid the harm. So you put barriers.
And in terms of those barriers, one of the barriers that it can have when you're trying to make change is trying to get on to the people who make policy. But it seems as though you all don't have as large of a barrier, because part of the engagement process, innovation pathways, will involve the Minister of Health, leading stakeholders associated with the sale and distribution of cigarettes, Pharmacy Board, Cancer Society of Trinidad and Tobago. Tetiana, how important is it that these stakeholders are going to be part of the discussions and the talks that you're having while you're here?
It is crucial to have this conversation, and exactly we are trying to reach the policymakers and not the people who are working in selling and distribution, because we are talking specifically about public health and innovations that can help to contribute to this discussion. But definitely, I think that what we're aiming for in our work is the evidence-based policy. And that's why we would like to show the data. What are the countries who are the leaders? So we will be talking about the success of the countries when it comes to the European Union. So it is Sweden, for example, with a current rate of 5.3% of people who smoke, which is about to get the smoke-free status in Europe. Coming from European background, we can talk about the public health goals there, right? And unfortunately, the European Union is lagging behind, and it's not achieving its smoke-free goals. However, we can see that when different ministries come around together, as in Czech Republic, that is currently going lower on the smoking rates, when there is no excuse for the tradition of smoking as they do in Greece, but they start embracing innovations and they start speaking about smart regulations and going not for the prohibition policies, but being open to have this conversation. We need to show the data, we need to show the numbers, and we need to speak about the public health benefits, because smoking, unfortunately, killing so many people, and we need to understand how to make choices safer for the consumers and to think about them.
Do you have data for a space like the Caribbean? And I say that because to Miguel's point, the experience in one place and what might be considered success in one space might not be in another. So have you done work in the Caribbean or a space like this before?
Yes, before going here, we also got the numbers on Trinidad and Tobago. It is 19.5% for adult males who smoke, and that's why we want to understand how we can better discuss the local context and what models can be more applicable, given that, of course, the situations are different, the current policies are different, but I think that while there is the room for the productive conversation, for the productive dialogue, and the willingness to hear and to learn from each other, this is how we come into fruition, this is how we achieve better goals, and this is how we achieve the smoke-free future for different multiple countries.
Miguel, talk to me about regulation, thank you. Because regulating e-cigarettes, is it the same as regulating normal cigarettes? What are some of the other factors that we need to consider?
Yeah, we can take it two examples. Europe has a regulatory framework. We're trying to prevent it was the first of one of the first of the world, and they did regulate it very early, this product. Not just the content, but the branding, the local points of where you can buy it, the nicotine strength. So they regulated very early. And they did not have, like in Europe, you don't have the same problem with adolescents in vaping that has in the US, or in Brazil. In Brazil, we have that same problem. And when you look at the data, you look that if you do it early, it's okay. If you do it later, it becomes a problem, a very complex problem, because you can have adolescents using vaping, you can have illicit market, the more time they have to do the illicit activity, they become stronger and organized. So it's very important to regulate in the way that the regulation has to work. I know that it sounds silly, but Brazil has won this year an award from the implementation of the articles of the FCTC, the Tobacco Control Framework. But our numbers are worse than last year. So I don't understand why they will give an award to a country who grows 15% on smokers. So when we are talking about regulation, the regulation has to look to the results, not just to the process. The process is important, is very important. It has to be transparent. It has to be a lot of things, because process, I'm an engineer, I love process. But you cannot forget the results. The process exists to do a better result, and not the opposite way.
And moving towards that result, the event is at the Bricks Hotel tomorrow, Tuesday, the 28th of October, 10 a.m. to 12 noon. How do people, is there still space for people to engage, to attend? And we'll also share the email at the end of the conversation, which is momentarily. So how do people attend if they still can?
So right now we plan that event for invite only. However, we are planning to be very transparent about the event. So there will be the recording of the event and the panel. And if you share the information with your audience in the end, they should feel free to attend our website, follow us on social media. And also you can share our email. We recommend people reach out to us. We are happy to answer the questions. And we are happy to explain more on the subject that we were discussing today.
Tetiana Rak, Miguel Okumura, we want to thank you very much. Reminding you that letting you know rather, that the email, the URL, www.weareinnovation.global. That's www.weareinnovation.global. Thank you very much. Looking forward to see a process that yields both data and results. The Now Morning Show continues after this. Stay with us. We come back with more.
I don't need to follow no crowd to make my family proud. Man, a good soul. Man, a good soul.
Pretty girl.
You're
Do you know how many people ask me that? No, I did not paint me. My husband calls her Ritalin.